So welcome, like I said before, to the CA Bridge Regional Collaboratives. This is our first virtual kickoff. This is 1 in 4. We will have these regional collaboratives every quarter. So we're at the end of this collaborative, you'll get the dates, but we're really hoping that you come back, you bring friends that are interested in low barrier mat treatment. So definitely we welcome you today. This is wonderful with all of our attendees. So glad to see you guys here today.
Sorry.
So, welcome to our movement. We're here to build a statewide. So, we always aim for high here at CA Bridge, but we want a statewide treatment access network. And for our navigators, that's kind of what you're doing on Slack, our Slack channel. But we want this again. We want it huge, a big access network, and you just being here. All of our people that are here, our community partners, our counties, our navigators, our hospitals, wherever you are an integral part to our success, and thank you for being here today. Together, we're going to make low barrier mat treatment for addiction available in every community in California. So again, we're really excited to have you here today. I just kind of want to go over that for the regional part, we will be breaking out in rooms today for you guys to talk about what's going on in your region. So just kind of a preview, if you can get your audio and visual working, that would be great for the later half of our virtual today. So if not, it's okay. If you can type in the chat, and if you just need to listen, that's okay too. We're still excited to have you here. All righty, let's move forward. My name is Sherry Cisneros, and I am the Navigator Program Director for California Bridge. And it is my honor to co-host today with Dr. Amy Mullen. If you guys don't know Dr. Amy Mullen, you will know her today. And like I said, it's an honor for her to be my co-host today. She is one of the founding members of CA Bridge and truly a role model and inspiration for all the work that she has done. She is also a professor at UC Davis in the Department of Emergency Medicine, and she is a chief of the Division of Addiction Medicine. So we're excited to have her here today to launch off. I'll have you say, she was my mentor in this whole process. So we're really excited to have her today to speak with us. All right. So if you don't know who CA Bridge is, well, we are a part of the Bridge Center, which provides many different programs. So CA Bridge has grown to the Bridge Center. We do many other programs. You might be involved in EDSP or EMS or Access Bridge. There's many different programs, like I said. So we're really excited to have you here as well. They do national work, and Bridge is also a part of Public Health Institute. So that has not changed. We receive support from Public Health Institute and our partners Department of Healthcare Services. So again, we are all connected, and we're happy to have you here today, and we will be sharing a recording of this collaborative, and as well as the slide deck in a post-event email. So for the agenda today, just want to let you know, we are going to talk about CA Bridge. So if you don't know us, you're going to know us today. We're going to talk about the community healthcare worker Medi-Cal billing. We're going to be talking about the certification as well. And of course, Dr. Mullen is going to give a wonderful session about low barrier treatment and access expansion. So stay tuned. And then our last part of the agenda today will be our breakout rooms. So these are our learning objectives. If you came for CEUs for CHW peer support specialists through Calix Mesa, or SUD counseling CEUs through CADAP or CCAP, we will be sending out a post-event email with an evaluation. So these are our objectives today. And I am going to hand it over to Dr. Amy Mullen.
Thank you. I am so excited to see all of you here and so excited we have so many folks from across the state, from so many different multidisciplinary organizations. This is why this is going to work because you all are here. I'm also excited that we have some folks who are new to CA Bridge. Really excited to have you. And just to let you know, this is a group of movers and shakers. This is a group of change makers. So I want to welcome you to the movement. If you are someone who is interested in making big changes in the system, you have found your home because that is what we are here to do. So excited to have you and excited to bring you into our family because we got a lot of things to do here in California. Next slide. And as we go, I want to talk a little bit about this is a group that has taken on big things and accomplished them. So we're excited to have you because we got a lot that we are going to do together. So we set out in 2019 to have 24/7 access to substance use and navigation and addiction treatment in every hospital in California. When you start with a small number of 8 hospitals, getting to that 290, 300 number seems huge and impossible, but we pretty much got there. And we did it in a really short period of time. So we have really come a long way. And it is thanks to most of the folks who are on this call, our amazing navigators who have been doing that hard work of changing culture and changing the treatment system in their hospitals and in their communities. And we're going to continue to build on that success. So excited to have you all here. Next slide. This is really the hallmark of our model, and that is low barrier treatment. So the key innovation of California Bridge is that when someone comes in with a substance use disorder, opioid use disorder, we provide treatment. But the first thing we need to do is to see that person where they are and provide low barrier treatments. There should be no barriers, nothing between that person who needs care and the care that they need. The second pillar is that connection to community care. This is the second innovation of California Bridge, which I think is probably the most important, and that is our navigators. And to realize that recovery means having that support, that individual who can really support that person in connecting them to care, connecting them to the resources in the community, and being that bridge from where the person is now to where they're trying to go. And number 3 is a culture of harm reduction, and that we are really focused on meeting people where they are, addressing their needs, and doing it in a way that fits with their value structure so that we can really engage folks in care in whatever space that they're ready for it. So these are sort of the 3 pillars of the California Bridge model that we brought into our hospitals and our emergency departments that we saw be successful in that setting, and that together we're going to move throughout California. Next slide. And I wanted to really recognize all of the work that everyone has done on this call. And just to let you know, we're going to take this moment to celebrate all of the work and the recognition. And then we're going to move on because we got a lot of work to do. So I just want to acknowledge the work that everyone has done through our hospitals. So we have reached 276 hospitals with California Bridge programs. We're in almost every county across California. We're not at 100%. We're still going to get there. It just takes a little bit of time to drag those last couple laggards over the finish line. But really, we have come a long way in a very short period of time. And through that work, you all are engaging with a lot of patients. So this is really looking at estimates of people that we're able to engage across the state of California through our emergency departments and our hospitals. 8,500 people seen on a monthly basis. And of those, we're able to get discharge and follow-up appointments for 3,000 people, 2,000 prescriptions for MAT. It's really amazing work that's being done by our navigators out there every day, reaching folks who are really need help the most. In that, I think the other thing I'm most proud of is that you all are reaching the most high need folks, those who are not connected into care, who really are the ones that need our help. And so this is something that I'm extremely proud of, and really want to congratulate our navigators and all of you in our network out there who are doing this work. So amazing. Thank you. And I just want to celebrate, none of this could ever happen without our navigator teams who are doing the work on the ground. We see you, we hear you, we value you. And one of our major goals is to not only continue our navigator team, but grow this network, because we know that as many people and as many lives that you are changing, there is still so much more that we could do. So I just want to celebrate our navigator team and let you know, like, we need to grow this network, because there are so many more lives out there that y'all could change if we are able to grow and expand the work that you are doing. So take a moment. Want to shout out to our navigators. You are all amazing and you are my heroes. So thank you very much. Next slide. And so I'm going to pass it back to Sherry to talk about this community health worker billing, which is required in the emergency departments and is a part of the recognition of how important our navigator teams are to their communities, to their hospitals, and to their EDs. And turn it back over to you, Sherry. So thank you.
Thank you. We're going to go a little bit because if you remember, CA Bridge was working on this APL with DHCS more than a year ago. But guess what, you guys? The community health worker services in EDs are now officially an essential health benefit. The All Plan Letter 24-006 stated that managed care health plans are required to reimburse for CHW services in the ED and ensure members have access to our CHWs, our substance use navigators in the EDs. So this is really important because this is about sustainability. So we're really excited that that is in effect. Woohoo, you guys. And, you know, Dr. Mullen, thank you. You were a big advocate to make this happen. So what support do we offer for the APL 24-006? Well, we provide, we want to make sure CHW substance use navigation services are billable, right? And we know that they are. So we provide certification for CHWs who conduct substance use navigation services. We are a specialty, and your training, you know, is specific to substance use behavioral health navigation services. And we here at CA Bridge can certify you. So we're really excited about that. Technical assistance to hospitals. We provide around the CHW benefit. So, you know, we're your go-to people for resources about billing models, the business cases for CHWs, contracting best practices, and any administrative and operational change tactics. So again, we are here to support you. And if you need more information, please let us know. CA Bridge CHW certification. We meet all guidelines as provided for DHCS Medi-Cal billing reimbursement benefit. And to meet those guidelines, you must have self-attestation of lived experience, either your own personal or a family member's. You need to have a verification of 2,000 documented hours in substance use navigation and training in the core competencies for CHWs. So your supervising provider must sign off that you do have all of those hours, and as well is competent in the training core competencies designated by Medi-Cal DHCS. So we're really excited, like I said, that we provide this training and certification. So to date, we have 133 navigators certified in 9 months. So you guys, thank you again. This is, you know, Dr. Mullen, we appreciate you. You've done the work. we're so glad that you get credit for the work you've done. And this was done between June last year to February, as of February 2025. We are happy to offer that we are expanding CHW certification to include individuals with any SUD experience who meet core CHW requirements. So if you're working outside of the hospital and you want those, please contact us because we really want to expand our CHW certification for SUD, substance use disorder experience. Specifically, this is a specialty. You can contact us at mentors@cabridge.org, and we offer free training for the core curriculum through our CA Bridge Academy, which we will be giving information later. All right, next up, I have a navigator story, and I am going to let Katie Kohada of University of California, Irvine. We are so happy to have her here today. She is a regional mentor, so we're really excited for her to share a story. We want to see what the navigators are doing because they have so many wonderful stories, and it really brings it home. Katie, are you with us?
Yeah, I'm here. Can you hear me?
Yes, you're perfect. Would you mind sharing us one of your stories about a patient?
Yeah, no problem. Sorry I'm on my phone. I was having technical difficulties this morning. But like Sherry said, I am the regional mentor for Orange County and Long Beach. I'm the substance use navigator at UC Irvine Medical Center. And the patient story I wanted to share today has a pregnant woman who came to my medical center seeking to get on buprenorphine in her second trimester or so. And we were able to admit her and do fetal monitoring so she can have a safe initiation on buprenorphine. Um, One of the things that proved to be a little complicated was she had Medi-Cal that was assigned to Inland Empire, so Riverside County. She was living with family in Los Angeles, and she chose to come to Orange County to get medical care. So when I was saying, where are we going to have you follow up? What are we going to do when you discharge from here? Proved a little difficult, but ultimately I was able to work with our social work team at the hospital and also work with the Riverside, the Inland Empire Cares Line is what it's called. And it's a hotline for all Medi-Cal people, all Medi-Cal subscribers in Riverside and Inland Empire, where they can get assistance with substance use and get into programs and get into different services. So I worked with them and I worked with her family and I worked with the social worker. Ultimately, we were able to discharge her to a facility that allowed pregnant women to come in and had specialty care just for them. Um, but it took a lot of navigation. I don't think it was something that I think the average layperson would be able to navigate by themselves. So I was really glad I was able to help her out. And that's just one of the examples of low barrier mat care that we are able to offer, in part because of our awesome physicians at the hospital, but in part because I was able to help her out too.
Thank you so much, Katie. And just shows the work that you're doing and supported. And it's a really a multi-discipline approach. And that's why everybody's here today, because every part, the community was part of this, the navigation, the hospital. So this is just a really wonderful example of what our CHW navigators are doing in the field. Thank you so much, Katie, for sharing that story with us. Next up, I'm going to pass it back to Dr. Mullen.
Yeah, I love those stories, and I'll be honest with you, those are the stories that I think keep us all motivated is like that life changed that you all were able to do and that difference that you're able to make for that person. Um, and so really all those stories, more than any of the data or the numbers, really tell us like the impact that we're having in the community. So just thank you so much for sharing, and thank you for the work that you do every day. I think it also really talks about like where we're going and this piece around low barrier treatment. And we talked a little bit about the beginning of like you're joining a movement. So those of you who are new, who feel like you weren't part of what we have done, well, I'm telling you, we got a lot more to do. And so our goal is really to make that low barrier standard that happened that changed the life for this patient, standard everywhere. And I've seen some pieces in the chat around like, how do we access our navigators and how can we connect more so that we are building this beautiful space where everybody has access to that low barrier care. And so that's kind of the goal of where we're trying to go with this movement. Thank you for joining us. And I want to say what we're looking at is, this is our data in California about overdose deaths. And although it looks like we are starting to flatten out here in California, the number is still unacceptably high. And so that we really need to focus and continue to dig in and expand this low barrier access to everyone in our community and perform those connections so that everybody can have access. Next slide. So what is low barrier care? Low barrier care is what we're trying to do in our hospitals and emergency departments where medications are offered first. A lot of the history of substance use treatment, there's been a lot of barriers placed in front of individuals that put them between medications. And so really we want to focus on giving people access to medication. So if someone is experiencing withdrawal, we treat the withdrawal first. And so it's that upfront stabilization where we can meet that person where they are, address their needs so that they can also begin that long process of engaging in outpatient treatment. It really impacts how people engage in the treatment space and that recognizes, addiction, substance use disorders, this is a chronic illness. And so that concept of relapse and re-engagement, that is a natural part of the disease process. And we need to be there to support patients. And so that a relapse is not a failure. It is an expected outcome that we need to be able to support someone through. And so when someone relapses, they have not failed, we don't reject them. That's a moment when we re-engage and offer them more services. And also understanding like schedule flexibility, telehealth. A lot of folks have logistical transportation barriers that we need to be able to help them to overcome. So low barrier care is really focused on the individual and making it easy for them to access care. We're at a competitive disadvantage, right? Fentanyl is really easy to get on the streets. And so we need to make our system of care as easy to access as it is to access fentanyl. Next slide. And so low barrier care, this is not just for those of you who are out there like, this is really different from what I have heard. This is not just something we've made up. SAMHSA actually recommends low barrier treatment care. And so they've actually put out guidance that's over a year old on what low barrier care should look like. And a lot of it has to do with the stuff that we've been talking about, medication first, telehealth, having that same day availability, flexible hours in order to make care easy for patients. And to really focus on like if someone has a relapse or loses their appointment, that we rapidly bring them back into care. That really the goal is to limit the severity and duration of relapse. And so if anyone needs to re-engage in care, that's a moment when we reach out to them and bring them back in the way that is most low barrier as possible. Next slide. And really, this is the focus of this. The buprenorphine saves lives. As a physician, buprenorphine is one of the most effective treatments that I give. As an emergency physician, we do a lot of stuff out there that is not nearly as effective as writing a prescription for buprenorphine. And so once I started to understand how effective this medication is, we really realized the goal is to get as many people access to buprenorphine as possible. But the data shows that it improves treatment outcomes. It reduces mortality, enhances quality of life, and buprenorphine can be effective with or without counseling. So if someone is not ready to engage in counseling, that is okay. If they just want access to the medications at this moment, and that is what they're able to engage in, it will still be effective. And so ideally, that can be the entry spot and the other stuff can follow. But none of this should be a precondition for the medications. And that model of low barrier access, connection to community, and that culture of harm reduction, that is the model that we're hoping to push out and that will be in all of our treatment spaces. Next slide. And so this is also the telehealth rules and that low barrier access. This was recently announced by the DEA. So previously, low barrier access to telehealth was based on some COVID related relaxation of regulations, but those have been made permanent. And so this is also not just something that we are made up here in California, although I think we're better at it than anyone else, that this has really been shown to be effective. And so the DEA has supported telehealth low barrier access to buprenorphine. Next slide. So really this is the treatment system that we're going to build together through our regional collaboratives. And ideally, this is a treatment system that engages and brings more people into that recovery space. Our goal here is to build this wraparound system that's truly, we talk a lot about that no wrong door access, but what that means is someone walks in a door and they get treated. They don't get referred somewhere else, they get treated. And so what we're looking at here is the system of care that is low barrier, but also connected. And that's what we need each other for. And that's really going to be the goal of what we're going to drive together through our regional collaboratives. We have our emergency departments, and ideally that emergency department network is going to become more robust as we grow that navigator piece that are providing that walk-in 24/7 low barrier access emergency department. I think is still critical. There's nobody else that's open at 3 o'clock on a Saturday, 3 a.m. on a Saturday. You can walk in and get treated and have that better connected treatment centers, either through our county drug medical clinics, who are also offering the OTPs, methadone, residential treatment system through our counties. Also integrated with our health clinics that can offer buprenorphine. We've seen a lot of success for low barrier MAT clinics that are also within our community health clinics. So there's a huge role for both our county drug medical clinics as well as our community health clinics to work together. And then telehealth. We have seen telehealth really break down barriers, expand access to folks who have transportation barriers, that telehealth can really be that piece that helps our outpatient clinics, our drug medical centers to extend their reach into the communities and provide that low barrier access. So this is what we're doing. We are moving from just our emergency departments out into the clinic space and hopefully creating this network of low barrier access that can help engage and work with patients to bring them into care and re-engage them into care. So this is what we're all going to build together, and I'm excited for our movement. So thank you all. Next slide. This is our goal. Previously, our goal was around hospitals and embedding our navigators in every hospital. But I think we're at this point when really what we need to do is to take that unacceptably high rate of overdose death, cut it in half. I mean, I'd love to cut it all the way back to zero, but let's start with this. Let's cut it in half by 2030. So this is what our movement is going to do. Our plan is to cut that overdose death rate by 50% by 2030, and this is where we are going, and this is what we are going to do together. This is going to build on our success. So thank you for the work you've done, and let's dig in because we've got a lot more to do, and we need more friends. So everybody here who's new, thank you for coming, and phone a friend and bring them next time, because we need more of you to build our movement. Next slide. So how are we going to do this? How are we going to reduce overdose deaths by 50% across our huge, enormous, varied state? Low barrier access. So our strategy is to make low barrier same day MAT available to everyone in every California community, so that it doesn't require all of these gymnastics and trying to fit someone into a treatment spot. That low barrier same day MAT is open to every person in California in every community. So this is what we are going to build together, is that low barrier access to achieve our goal of reducing overdose deaths by 50%. And I know we can get there. Next slide. So I'm very excited. This is what we're building together. And the way that we're going to do it is through our regional collaboratives. Thank you so much for the work that you're doing. I'm going to turn this over to, oh, actually, so never mind. I've got two more. Where'd the slides go? We're going to go ahead and work through our regional collaboratives to expand our network and build this together. What I'm hoping you all want to do, I'm hoping you're excited to join us, to join this group of amazing change people who are going to join our movement to build this statewide treatment access network. We're going to continue hosting our regional collaboratives. We're going to bring people together from all parts of the treatment ecosystem. We want to identify and connect regional champions. We want to facilitate local expansion of low barrier MAT. And I want to do, like someone mentioned in the chat, like, how do I know where my navigators are? How do I know where my low barrier treatment providers are? We want you all to have those connections so that you can build that network for patients, but also because we know that we are stronger together. And so when we come together as a group, when we build our movement, we can accomplish more than we ever thought. So thank you. And I'm going to turn it over to Sherry to split us up into our groups to go take on our communities and together change the whole state. Thank you.
Thank you, Dr. Mullen. I just, when this was just a vision of Dr. Mullen, we're just like, how are we going to get people here? But you guys are passionate and persistent, and this is just wonderful to have so many people here wanting to do this advocacy in your own communities. So we're trying to break down silos to get people talking and keep them talking. That's the goal, is making sure we have the right people in the rooms, talking, engaging, and just trying to expand low barrier mat treatment. All right, everybody back now. So I am real quickly going to pick on some people here. Our mentors, I really want to know from our mentors. I'm going to pick on Chaya. First of all, Chaya, did you have in your room a key takeaway or something that was very interesting for you in your room for Central Valley? Are you there, Chaya?
We lost Chaya.
We lost Chaya. All right. Okay, well,
Can you
hold
hear
that.
me?
Yes, we can hear you. There you
Technical difficulties today. All right. Well, my group, I think we talked about a little bit about the services that were available. But what really stood out to me was that we were making connections. Had a few people exchanging their contacts, saying, "Oh, we need that service. We would like to get connected." So I was just like, "Yes, that's what the collabs are, the breakouts are for." And definitely, I heard a need for having an active coalition. We see some other counties are doing great, and we would like to see that more in some other counties too. Our county Department of Public Health is offering some great support for the harm reduction services and also HIV and STD programs. So that's a great win. And yeah.
I'm glad to hear that. There was so much going on in the room. I'm really excited to hear that, you guys. And I hope all of these rooms, you connected or, we can build on for next time in June, build on these relationships. I'm going to pick on next. Raphael, are you with us? He's Northern Rural.
I am.
What was the key takeaway or the most interesting thing you heard in your room?
Yeah, the key takeaway I got was, we are all experiencing, pretty much the same barriers to services. And, I think that it's wonderful that we're getting connected and we're getting to know each other. I'm so excited to get to know some of our folks in Shasta. Yeah, so I think just a key barrier was getting to know each other and getting to see the services that they provide. We're still experiencing the same barriers. So I think that, like you said, we're going to have a lot to come back to in June or July, was it?
June, it'll
Yeah.
be in June. So that's wonderful to hear. I'm going to pick on one more mentor. Let me go with Melissa or Robbie. Do you want to tell me a key takeaway or something?
Thing about our room was a lot of great information anyways. But just I think we all agreed that certain organizations need to step their game up because we're losing too many patients waiting on them. But in time, I hope things will get better. Things always have to get bad before they get worse. Get bad before they get better. So yeah.
Awesome. I'm glad. I'm glad you're making those connections because that's what's going to
Yes.
help. Excellent. Melissa, and this is for the Inland Empire. That is for the Riverside, San Bernardino. Melissa, anything you want to add?
Yeah, I think it was a great conversation where we're able to connect and talk about some of the strengths, as well as the areas that we'd like to improve. And a common theme that I was noticing is maybe quick access to a lot of those services and being able to network, right? Access to contacts like where is our mobile 24/7 service? Other support services like homeless services, as well as, navigator contact information. So we had a really good discussion as far as like who else should be, we're coming to this space. And it sounds like great representation maybe that we can bring from both county partners into a collaborative space such as this would be very beneficial. So really great takeaways. We made sure to take a lot of notes and we want to be able to bring it back into our next collaborative.
That's awesome. And I love to hear because I know Dr. Mullen did mention about those wraparound services. So that's great that you mentioned that because it's all integrated and it's really, a total multidisciplinary approach, you guys. Our patients that no closed door, every door is an open door, that's what our goal is. So we're really glad to hear those conversations are happening. I will also want to hear from either Genevieve or Jolie in the LA Ventura room. Do you guys have any takeaways or any interesting things that you've heard in your room that you want to share?
Hello. Yes. So in our room, I think we had a lot of the same conversations that others were having regarding the barrier to services and such. One of the takeaways I think is that I kind of knew this before, and then I was reminded that the availability of Bridge to be able to be a resource for not only us as navigators or people that are related to the California Bridge, but to the providers that are in the ED and that could use a little bit of education or encouragement from other physicians. I think that is important, an important key that we talked about.
Excellent. Thank you for sharing. Anything else, Jolie?
I guess I would piggyback off of what Genevieve said. That was kind of the biggest takeaway, I think. Just being able to have resources for physicians in the ED to kind of, if they're not 100%, they can kind of refer back to Bridge. And that has been very helpful.
Excellent. Well, I thank you. I'd love to hear from all of our mentors. We're going past time, so I will pick on you guys next time in June. So if I didn't get you today, mentors, I'll catch you in June for sure. Because I just want to be mindful of time, and I know, time is precious for all of us. So thank you so much for sharing. And, we're glad to hear these positive outcomes, because this is what we wanted to do. This is the purpose, is to really help our communities expand low barrier mat treatment. We just have a few more things to say before we end this with you. And again, we thank you for your time and choosing to come to this collaborative. This is our very first one. There will be 3 more, and we're going to build. So although you might meet people today, it may be next time in June when you come, and bring a friend to build on what you've started here today. So all of the discussion you have, if you used a whiteboard or if you have the chat, we're going to kind of hold on that to information until you come back in June, and we can summarize it for you in your room, because we gotta keep you connected with us. And again, this is just our initial kickoff, and we really wanted you to make those connections. And if there's somebody in your room that, should be there, let's invite them and bring them to the next time. Our next virtual meetings are going to be in June, September, and December, and more information will be out or on our website when we release those days. But definitely come back. It's going to be kind of the same thing. We're glad for this feedback that you guys gave us. Definitely, we want these virtuals to be useful for you. Doesn't matter if they're useful for us, but we want to make sure that they're using your time correctly. And then we have added to this project, we've have our in-person regional meetings. So those 10 regions that we talked about, we are going to be having one live training near a region near you. So we have a couple of dates for our first two. One is Central Valley. It will be in Fresno on March 13th. So if you want to do it, we are going to expand and have a little more time. But so it will be a little different, and you're welcome to come. This is for the Central Valley, March 13th. And then our Greater Sacramento will be held April 22nd in Sacramento. And again, we're going to be expanding. It's a little bit different. And so we really encourage you to come to an in-person regional near you. Definitely, we're going to have them in our 10 regions, more dates to be determined as we get closer. So again, we want you to come back. We want you to attend it in person and kind of pair with what we're learning here in our collaboratives with really getting down to your communities, bringing people together. So if you have any questions about the regional collaboratives, if you want to invite people, we are opening our doors. And so we are happy that if you invite, somebody who's a partner or somebody you want to learn about what CA Bridge is and all the things that we offer, you can contact us at mentors@cabridge.org. Here is our information. You can scan it if you're a QR code person. I know there's people that are not, so we also have just the email address at mentors@cabridge.org. We really hope that this has been useful for you, and we accept all feedback. You will get a post-event email. And again, if you have a CEU, need CEUs for CHW, peer support specialist, and SUD counselors through CADAP and CCAP, please fill out that evaluation. With a few minutes left, we really thank you. You are the reason why we're here and making things successful. And I really want to thank again, not only our people that participated, but our comms team. Big shout out for the breakouts, with this many attendees. It was wonderful. I can't express enough support and appreciation for everything that you've done to make these regional collaboratives wonderful. Thank you for attending. And I'm going to leave with this quote, and it comes at a really emotional time in the world. Change will not come if we wait for some other person or some other time. We are the ones we've been waiting for. We are the change that we seek. Barack Obama. So again, you are the change. You are the advocates. I so appreciate your dedication to our patients, and I am going to tell you until next time, I'm not going to say goodbye. We're going to see you either at your regional and at the quarterlies. So the next time will be in June. If we're not in a region near you, stay tuned to our website under live training. They will all of our dates will be released on that site. If there's any questions, feel free, mentors@cabridge.org. If you need any assistance, we have our CA Bridge Academy, and those are free trainings. So please do not hesitate to contact us. And until next time, you guys, thank you so much for coming.